Hello, Dr. Joe here of the AskDrJoe.org and the 2020from.com. So today, what have I got for you? Well, I just want to do a quick video where I want to share with you something interesting but yet disturbing that is going on in the weight loss world. The medications that are being used for weight loss management, the newer medications, which sort of prove themselves to be somewhat effective. However, they have a new side effect that has been revealed by what we call pharmacovigilance. And that's what I'm going to be sharing with you. This new side effect that has been picked up by this pharmacovigilance is giving the health regulatory authorities sleepless nights. So I'm going to be sharing that with you in this video, and I'm also going to share with you what you should do if you find yourself in those situations. So let's kick off with, first of all, what's going on in Europe. What's giving the European authorities sleepless nights? Let's see what's going on there, first of all.
Okay, so let's kick off with the European Medicines Agency official statement. This is their website. It says EMA, which is European Medicines Agency, statement on ongoing review of GLP-1 receptor agonists. The statement is dated on the 11th of July 2023. It says EMA Safety Committee, the Pharmacovigilance Risk Assessment Committee, PRAC, is reviewing data on the risk of suicidal thoughts and thoughts of self-harm with medicines known as GLP-1 receptor agonists, including Ozempic, semaglutide, Saxenda, liraglutide, and Wegovy, semaglutide. These medicines are used for weight loss and for treating type 2 diabetes. The statement continues. The review was triggered by the Icelandic Medicines Agency following reports of suicidal thoughts and self-injury in people using liraglutide and semaglutide medicines. So far, authorities have retrieved and are analyzing about 150 reports of possible cases of self-injury and suicidal thoughts. They seem to be telling us that the review of Ozempic, Saxenda, and Wegovy started on the 3rd of July and has now been extended to include other GLP-1 receptor agonists. The review is expected to conclude in November 2023. There you go. So this is the European Medicines Agency saying that.
So that is the bigger part of Europe. What about a smaller corner of Europe called the United Kingdom? What is giving the authorities there concerns regarding Wegovy, Ozempic, and liraglutide?
Okay, so here is the official Reuters website. It says exclusive. UK probes Novo's Ozempic, weight loss drug Saxenda over suicidal self-harming thoughts. So it says here, let's highlight this. Britain is reviewing a class of drugs used in diabetes medicine and a weight loss treatment sold by Novo Nordisk after some patients reported suicidal or self-harming thoughts 2 weeks after similar action by the European Union. News item continues. The Medicines and Healthcare Products Regulatory Agency, which is the MHRA, said in a statement to Reuters late on Tuesday it was reviewing safety data on a class of drugs known as GLP-1 receptor agonists. The statement also continues. It says that this includes Novo's Ozempic, which contains the active ingredient semaglutide and is approved to treat type 2 diabetes. Another drug being reviewed is Novo's Saxenda, which contains the active ingredient liraglutide and is approved as a weight loss treatment. Saxenda is Novo's older GLP-1 drug and has lower effectiveness than its newer obesity treatment Wegovy, which contains semaglutide. Continues, says Novo told Reuters it had received a request on Monday from MHRA about the agency's review of potential suicidal and self-harming thoughts related to GLP-1 drugs. So there you go. Reuters confirming that the UK regulatory authority, MHRA, is now looking into Ozempic, Saxenda, and of course they're going to extend it to others in the class, which will include Wegovy and all the others. So there we go. Reuters telling us about what's going on in the UK there.
So that is the right side of the Atlantic Ocean. What about the west side of the Atlantic Ocean? What's going on there? Well, I am aware that the FDA have had reported cases of suicide attempts or suicidal ideation, and indeed, for liraglutide, there have been 25 confirmed cases of suicides that are related to liraglutide. It is not certain whether liraglutide was solely responsible for that, but there is a link between the two. So the FDA is aware of that. So the other thing I did was I had a look at the patient information leaflet for these medications to see whether there has been any mention of any possible mental health side effects. And I've got to say that there's a common theme running through the leaflets for these medications. The mental health side effects, the possible mental health side effects, have been downplayed in these very leaflets. Now, whether this was a deliberate attempt by the drug companies to hide the side effects is difficult to say, but it's not highlighted. In any case, now it is becoming obvious that something is going on, and we are going to see what the investigations come up with towards the end of the year. So, in the meantime, though, what should you do if you're using these medications? So, the first thing I would say is that for the vast majority of people using these medications, if your mental health is quite stable, then there's a very good chance you probably are not going to have any problems with them. However, if you're someone who's had problems with your mental health in the past, my advice for you would be to that you should go see your doctor and have a chat with your doctor. Both of you should sit down and do a risk-benefit analysis. Obviously, if the benefits outweigh the risks, then fine, you can continue using these medications. But if the risks outweigh the benefits, if the mental health risks outweigh the benefits, then you've got to really seriously think about whether this is a path you want to continue on. You really need to rethink that because there are always alternatives. I know that weight loss can be a little bit tricky for quite a number of people. But I don't think, as far as I'm concerned, I don't think the mental health risk of things like suicide are worth it. Because here's the thing, you have to have the suicidal ideation, the suicidal thoughts before any such event can actually take place. It is the thoughts, the ideation that will lead to action. So if you're having any suicidal thoughts at all, any ideation, please go see your doctor and have a chat with your doctor and decide on what you're going to do going forward. Okay, that's my little advice for you, and I'm hoping that you got some value from this very video. If you did, please give the video a thumbs up, please like the video, and also please share this video with your friends, with your family, with your colleagues. If you know anybody who is using these medications, the Wegovys, the Ozempics, and the liraglutides, and indeed all the other medications that belong to this class, please share this video with them. If you got any questions, any comments regarding what I've discussed here in this very video, go ahead, leave your questions or comments down below. In fact, I'd like to know what your thoughts are regarding what I've talked about in this very video. I think that's about it for this video. Until next time, well, this is Dr. Joe signing out.